again, we've got the perfect storm of the pandemic, which has caused so much emotional, social disruption, and the third wave of the opiate epidemic, which is so much more deadly. So the question is, what do we do with that? And the answer is we have to meet people where they are at. The most important thing, as Dr. Joseph had said, and even I've seen many at Dr. LaPietra training, is we need to keep people alive. We need to keep people alive, because if we don't keep people alive, they don't have an opportunity for change. But what that means is we have to change the way we approach people and the way we approach the change process. And what that can look like is modalities such as motivational interviewing, modalities such as harm reduction. These are modalities that in the past may have been controversial. You know, people see harm reduction here, harm reduction, it may trigger some feelings like, well, if we tell people they can use, does that mean we're condoning use? Does that mean we're enabling use? And the answer is no. The answer is the change process for anyone, despite the circumstances, is difficult, you know, and I ask everyone to reflect internally on a time where they were asked to change, you know, on a time where they made an effort to make a life-altering change, and how difficult that was, even if it was something small, you know. And what we're asking of individuals in recovery is to change their entire life, people, places, things, everything. And what we're starting to recognize, thankfully, through evidence-based research, is to see that it is much better to meet someone where they are at, even if that means they might still be using, but using at a point where they're not putting themselves at risk of death. That meeting them there and helping guide them to a place of change is much better than trying to meet them head on and force that change. And again, motivational interviewing is similar in the sense of meeting a person where they're at in the change process and walking a parallel line with them to a place of recovery.